Hi, my name is Gabrielle, and along with Brittany, Nicole, and Jessica, we targeted fruit and vegetable consumption as a health behavior in America to research. And just a little bit of background on the history and summary of fruit and vegetable consumption. Basically, increasing fruits and vegetables in the diet is shown as a key method of prevention, and a lot of school programs are popular right now because they're a form of early intervention for a healthy lifestyle. And basically, increasing chronic diseases is kind of showing everybody why it's important to increase fruit and vegetable intake. There are several studies that have been done, as you can see. One showed there's an increase in total life expectancy. One showed that, the overall lack of fruit and vegetable intake in young children, and then showing also that, schools that had food policies in place had a higher intake of fruit and vegetable consumption among children. In terms of recommendations for consumption, the general guideline is that 5 servings of fruit and vegetables are eaten per day. Again, increased fruit and vegetable consumption is being shown as with a lower disease risk, specifically a lower risk for cancer. But there are a lot of barriers to this behavior, like cost, lack of time to prepare the food, and availability to the food. Fruit and vegetable consumption has declined pretty substantially in the last couple of decades. But it's also been shown that people who eat more fruits and vegetables are those who have higher income and higher education. As far as importance of fruits and vegetable intake goes, overall studies have shown reduced risk of dementia and depression, reduced risk of chronic diseases, a lot of reduced lifestyle diseases like heart disease, stroke, hypertension, metabolic syndrome. And most studies, just link increased fruit and vegetable consumption with overall health benefits. The target audience is really everybody, everywhere across the country and the world. Specifically for our group project, we looked at America just to narrow down different campaigns. Preschool programs and, well, all school programs, but preschool programs specifically have been shown to fall short in providing enough nutrition. So some programs have used teachers using the information, motivation, behavioral skills model to create education for them and to make school lunch programs to increase fruit and vegetable consumption. Studies are showing that, most, 36% of adults, 39% of high schoolers eat fruit less than once daily, and similar results for vegetable consumption as well. But it might prevent weight gain, increased consumption of fruits and vegetables. So another target population could be the overweight and the obese. As far as risk, those at risk include those of low socioeconomic status, men, young adults, and those who have, a lack of financial means as well. So this table here shows that although people are recommended to have 5 servings of fruits and vegetables per day, and those of low socioeconomic status are struggling to get this amount, but the studies have come out showing, a study by Stewart and Hyman showed that people can get enough fruits and vegetables per day by spending $2.10 to $2.60 per day. So the poor campaign our group found was the 5 a day program founded by the World Health Organization. Just basically told people to eat 5 servings of fruits and vegetables per day. And one portion is defined as 80 grams of fruit or vegetable. For example, an apple or a banana or 2 spears of broccoli. To apply theory to this campaign, the health belief model was a big theme in this theory because, just showing net gains of improved health and decreased risk of lifestyle diseases. The fear appeal model was also important because the campaign was started to reduce rates of death in the United States from chronic disease, so just to avoid bad health conditions. As far as effectiveness goes, the campaign had limited effects. People were confused about what was defined as a portion, and there were general guidelines about having 5 servings, but people didn't eat enough of green cruciferous vegetables, and just didn't have enough overall balance with it, according to Johnston and others in 2000. The good campaign that our group found was the Fruits and Veggies-More Matters, founded in 2007 to replace the 5-a-day campaign. And the CDC, along with the Produce for Better Health Foundation, made this program to better address dietary guidelines of individuals, finding that most people need more than 5 servings per day, according to USDA in 2015. The campaign showed how easy incorporating fruits and vegetables in the diet can be, and the website showed tips on how to get enough fruits and vegetables. Also putting their own logo on food packaging. Overall, the health belief model was very applicable to this program. The campaign focused on providing health motivation for people to increase intake and increase self-efficacy to reduce barriers and promote benefits by providing recipes and education on the different forms and integration of modern approaches to interaction. The campaign tried to counteract perceived barriers that people encounter. As far as effectiveness goes, people bought more fruits and vegetables with the More Matters logo on them, but only 2% of adults were actually aware of this campaign. The evidence showed that while the program was useful, it just wasn't well known. And there was, effective health motivation from the program, but the fact that it wasn't well known was a major downfall because the health belief model can't be successful without awareness, according to Roth in 2018. The excellent campaign was Wisconsin's, the SNAP program actually made this FNV social marketing campaign, and it was brought to us by the Partnership for a Healthy America. It targeted millennials to increase fruit and vegetable consumption by incorporating kind of a modern twist. They used celebrities, marketing tools, community partnerships to disperse the brand to adults ages 18 to 34 who were SNAP participants. The program was adopted in 2017 and made in 3 phases to target various communities just in Wisconsin, using billboards, retail, transportation, and social media. And they also had a farmers market campaign while the farmers market was in season. And you can see that they made, ads on buses to target specifically Green Bay Packers fans, telling them to eat green and gold. And as far as theory goes, in this campaign, it tried to reach audiences and promoted change while increasing fruits and vegetable consumption, according to England, Hedrick, Duffy, and Crack in 2020. The program went pretty deep using social marketing with the health behavior theory, using the theory of planned behavior specifically, to evaluate the campaign and disperse messages. It included features specific to various social determinants of health, like health literacy, socioeconomic status, and cultural relevance. As far as effectiveness goes, it's kind of being evaluated by University of North Carolina now, but preliminary findings were completed by the SNAP program, and the findings showed that so far, they're doing pre and post surveys. They're assessing retail data and doing key informant interviews, according to Cano and Agason in 2018. We thought this campaign was excellent because it had thorough application of theory and social marketing, and because it had promising preliminary findings, as shown on the slide here. Also, it won the National Social Market Award in 2018, which shows that it was actually more of a well-known program, way more well-known than the 5-a-day, at least in Wisconsin. As far as discussion, specific theories that are of importance are the theory of planned behavior and health belief model. We decided using a combination of these theories would be the most comprehensive approach to increasing fruit and vegetable consumption, because the theory of planned behavior offered a well-rounded approach to making behavioral change in all age groups, according to Deep and others, Schoberg and others, and England and others in 2014, 2004, and 2020. Also according to Godrin and others in 2006, by using constructs like attitude, normative beliefs, and perceived behavioral control to act on personal intentions. Additionally, in health communication practice, the concepts of net gain and health belief model complemented the theory of planned behavior and providing guidance and educating those of all ages the importance of fruits and vegetables and shifting health beliefs. Educational interventions using the health belief model can build on health communication campaigns and better inform audiences altogether. In terms of models and frameworks, the socio-ecological model and social determinants of health and social marketing were all very important. It's important to take into account the various social determinants of health. In addition, health communication practice using social marketing framework to assist in message design and delivery gave a solid foundation for shifting attitudes and health beliefs in teens and adults when it came to addressing fruits and vegetables, as shown in Wisconsin's campaign. It's important to note that we believe that all these components can be applied in intervention because it makes it more comprehensive and complete, rather than just selecting one theory to address the entire fruit and vegetable consumption intervention. Future applications include just using the theory of planned behavior and socio-ecological model can be used in research to know the audience of interest, to better inform messaging efforts. Social marketing framework can be used to distribute messaging, and the theory of planned behavior can be used again to evaluate receptiveness to message and to assess for any change in attitude and intention to increase fruit and vegetable consumption as the study and as interventions go on. Here are shown just the comprehensive list of the references used by our group. And that was all on the fruits and vegetables consumption. Thank you.